In this video, I am going to be addressing the medicines that you need to avoid if you have Parkinson's disease. There are multiple medications that could aggravate, exacerbate, or magnify the symptoms associated with your Parkinson's disease. And in first place, the medications that I want to discuss are medications used for the treatment of nausea or vomiting. So, in first place, medications like Phenergan, Reglan, and Compazine. These are medications that are considered dopamine blockers because they block dopamine. They can exacerbate the symptoms of Parkinson's disease. And the issue is that it might take days to weeks for this effect to be reversed and you go back to your usual level of the symptoms of Parkinson. So it is very critical that you avoid this. And I am mentioning these medications first because they are widely used in emergency rooms. They are widely used in the hospital at urgent cares whenever a person has nausea, vomiting, whenever a person is going for surgery, right? Many times the person will receive what we call a prophylactic dose of these medications to avoid nausea or vomiting in the future. But what is going to happen is that it could aggravate the symptoms of Parkinson's disease. Actually, the person might end up staying longer in the hospital because of this transient exacerbation of the symptoms. The other thing is that there can be interactions between the medicines to treat Parkinson's disease and medicines to treat cold. And what happens is that there is a class of medicine called monoamine oxidase inhibitors that might have interactions with medicines for your cold, such as dextromethorphan, for example. So it is very important that if you have a cold, discuss with your doctor about what are the potential therapeutic options. What would be the medicines that you can use in order to help with the symptoms. Medicines like ibuprofen, medicines like Tylenol are typically appropriate in the person with Parkinson's. However, these other medications that I just mentioned actually can cause a transient exacerbation of the symptoms, causing more trouble walking, more problems with sedation, and so on. Now, some people with Parkinson's disease might have hallucinations. It's part of the condition for some people. And whenever this happens, once again, we see that some people might be at risk of being prescribed a medicine that will make the symptoms much worse. So whenever a person is having hallucinations, in first place, we need to try to figure out why is that person hallucinating. So your doctor will be able to do some workup. They might check you for a urinary tract infection. They might check you for any other kind of infection. He will be looking into the medicines that you're taking, and then he will be able to recommend the best medication for you. The treatment of hallucinations in Parkinson's disease is very limited. I can count with the fingers of one hand how many medications are available to treat hallucinations in Parkinson's, and probably there will be some fingers left because we don't have that many options. However, what I want to make sure is that we avoid medicines like haloperidol. That is probably the worst medicine that you can use if you have hallucinations in Parkinson's disease because it will cause more somnolence, it will put you at risk of falls, and also it could aggravate the symptoms of Parkinson's disease because it is a strong dopamine blocker. Other medications that need to be avoided that are commonly used when a person comes with these kind of symptoms are risperidone, olanzapine, even Abilify, which is one of the newer medicines, might actually aggravate the symptoms of Parkinson's disease, even taking it for a short time. There are some safer options that your doctor will have to consider. Two options, there are probably the ones at the top of the list that might be used in those cases are pimavanserin and quetiapine. However, once again, I'm not telling you that those are the medicines that you're going to be taking. Those are the medicines that you might need to discuss with your doctor, or he might have some other alternatives at that time. Some doctors like to use antidepressants to treat Parkinson's hallucinations. But at the end of the day, you just have to have that close communication with your neurologist to choose the best medication that can be used for that condition. I really hope that you find this information to be useful, that you learn a little bit more about what are the medicines that need to be avoided. And as more medicines come that we feel that needs to be avoided or at least minimize the use in people with Parkinson's disease, we will continue updating in the future. Thank you for your attention. And once again, if you have any questions, something that you would like for us to discuss, please do not hesitate to email us, and we will be happy to have a video about that particular question or condition. Thank you.